I was requested at the last meeting to review district policies in relationship to the Blue Zone documentation. So what I have done is I have reviewed 7 board policies that I have identified as pertinent to health and wellness and related issues, and I've also reviewed Blue Zone documents. In particular, the policies I reviewed have been the following ones: 1, 8510 wellness; 2, 8500 nutrition services; 3, 2280 physical education; 4, 2417 comprehensive health education; 5, 2417 health services; 6, 5512 and its analog 7434, which pertains to staff tobacco-free environment; and number 7, 5830, which pertains to student fundraising. With respect to Blue Zone, I reviewed the following documents: Blue Zone's project blueprint, becoming a Blue Zone's community, Blue Zone's project pledge overview, and becoming a Blue Zone school. In the course of the review, I examined the concepts within district policies pertaining to the issues of health and wellness, goals established by the board in such policies with respect to wellness, health, nutrition and physical education programs, and working with outside agencies. I also reviewed the concepts of the Blue Zone Initiative documents. I examined their relationships to school environment, their relationship to district policies, and if there were any statements within them or requirements that could interfere with district policies that was of concern. And I know that was an issue that was raised, and I appreciate the concern raised by Ms. Donalds at the last meeting, which served as the foundation for this review. That being said, I will provide the board with an overview of the core concepts within the policies and the core principles within Blue Zone. Then I will seek to apply the facts and the issues within the Blue Zone documents to district policy. I would imagine and hopeful that this overview will take no more than 10 to 15 minutes so everybody can get on with the discussion. So let's begin. Policy 8510, the wellness policy. The first paragraph of the policy sets the tone by establishing that the board is committed to providing a learning environment to support and promote wellness, nutrition, and active lifestyle. It recognizes the relationship between, quote, nutrition, physical activity, and the capacity for students to develop and learn. In addition, the policy encourages schools and staff to be involved in comprehensive programs that are mindful of individual and community needs. Policy sets out multiple goals within 9 identified categories, including school food and nutrition, nutrition education, health education and life skills, physical education, health and safe environment, family, school, and community partnerships, emotional well-being, and student health services and staff wellness. So it encompasses a great deal of categories that set the tone for the wellness policy and what the board hopes to accomplish by it. In my view, the goal of the board food and nutrition policy promotes lifelong health, concern with appropriate eating habits and consumption of nutritious foods. It supports physical growth and brain development, emotional stability, and the ability to learn, and that's language that is contained as well within the policy. This goal is linked to the goals within actually the new nutrition education section, which also encourages working with community agencies and groups to enhance district nutrition education. So these are kind of integrated categories and concepts. The nutrition education goal is itself integrated with health education and life skills, the goal for which is to enhance knowledge of healthy foods, products, and a goal of practicing behaviors that will encourage healthy living, and development. The goal for the physical education section is to obtain skills, knowledge, and attitudes for lifelong physical activity, and the importance of devoting time, hopefully 60 minutes after school, to physical activity. The other category that's of importance in the policy as a goal is social and emotional well-being. There's also a goal for family, school, and community partnerships, which establishes to strengthen partnerships and relationships, quote, to improve both planning and implementation of health promotion projects, including specific direction to develop community partnerships for such purposes. At the end of Policy 8510 is the direction to the superintendent to ensure compliance with this wellness policy. In addition, it directs principals to be involved at the school level to monitor compliance with such policy, for example, to prepare reports and of any wellness program that they are involved in. Policy 8500 is a nutrition services policy. Let me begin by quoting, it is the intent of the board to promote the health and well-being of district students by providing a quality food service program. It is designed to be part of the district's educational and nutrition programs, so the concepts that are found in 8500 are indeed aligned with 8510. Within the general provision sections of Policy 8500, in particular Section C, is a statement about choice. It says, food choices shall be offered rather than served at all school levels in accordance with federal and state law. This includes, for example, selections of a la carte food. There is an effort to include choice within the structure of the policy. Policy 2280, dealing with physical education, is conceptually integrated with Policy 8510 and the board's commitment to the importance of physical education to encourage, quote, the development of a healthy, active life style. Then we come to Policy 2417, which is a comprehensive health education policy, which involves the development of an evidence-based comprehensive health education curriculum that addresses concepts of community health, consumer health, mental and emotional health, nutrition, and so on. Policy 2410 is a health services policy, and it establishes within its categories and goals those things that have been articulated in 8510, such as student health services, which will include nutrition assessment and health counseling as appropriate, and to coordinate with community health agencies such as the Collier County Health Department and staff when needed. So the policy itself looks toward outside agencies for educational and assessment support. Policy 5512, and as you know, the 5500 series pertains to students, and 7430, which applies to staff, is a tobacco-free environment policy directed to students and staff respectively. Board policy establishes that district facilities, vehicles, and property owned by the district shall be smoke and alcohol free and tobacco free. Policy 5830 is student fundraising, and we've heard some discussions in the comments this evening. This policy provides that with respect to the sale of food and or beverages to students, that it be consumed on district campus. When it is consumed on it, it will be in compliance with USDA nutrition standards and dietary guidelines. So that gives you an overview of the multiple policies that the district board has enacted. The Blue Zones Project Blueprint. In the blueprint document, Blue Zones Initiative has identified, in essence, what it calls 13 pillars for community health living that project believes are important, that one, involve community work sites, grocery stores, restaurants, schools, faith-based organization, as well as a commitment to public awareness with respect to health. Each pillar has an associated target. These are target goals. There is a food policy and a tobacco policy recommended. District already has this. There's also a safe route walking to school program, which the district is implementing. And there is a goal of having 12 Blue Zone schools over a 3-year period. This, of course, is dependent upon the discussion this evening. But as I read it, this proceeds at 4 identified schools per year times 3. And ultimately, the goal, as I understand it, is over an 8-year period, 50% of schools would be involved in this Blue Zone project. There is a focus as well in this document on encouraging broad community participation, including community-wide measures, reduction in the BMI, decrease in childhood obesity, increasing physical activity, increasing vegetable consumption, and the reduction of health care claims, and a concern with a decrease in diabetes, health disease, and cancer rate. With respect to the health care claims, that's an initiative that we already have underway within our own health care program.